So moving out from a typical healthcare organization, which we were focused internal earlier, as we talked about the system landscape of a typical healthcare organization, we talked about how they had an electronic medical record, maybe a practice management system, HR, finance, etc. Well, at MyHealth, we are seeking to not just enable a healthcare organization to access their own data um, in better ways than they currently can. We're also trying to solve the problem that a patient um, data actually lives in multiple organizations throughout a community. Um, a Even a large healthcare system cannot guarantee that their patient has not been to other providers, and there may be some very important data about that patient that lives in another system in another organization that they don't have access to at all. So if we look at this screen, it just kind of shows the problem. We have our patient represented here, um, but then we see that the patient is surrounded by many organizations that have information about their care um, and about the different treatments that they've been through, about the medications they've been on. So we see the title here says not just disparate systems as within a single healthcare organizations, but also disparate organizations. So a patient's data, they may have hospital data, they may have pharmacy data, they have imaging data, labs. The public health organizations have data on them, specialists, other PCPs that they've seen, and of course payers, on and on. So lots of different organizations have data about each patient, and in order to get the full picture, you need a different architecture, and that's what MyHealth is seeking to produce. And that's what we'll look at next. So this is a picture of the data architecture that we are putting together at MyHealth. Let's just walk through it from left to right here. So over here on the left, we see a picture of the community healthcare organizations, and we have some of our health systems listed, and of course there are many other community healthcare providers. We have payers that are very common for our community, um, even the Oklahoma Healthcare Authority. Then we also have labs like Regional Medical Lab or Quest or LabCorp. So lots of different organizations, and there are many more than what's listed here. That's just to give a flavor of the different organizations that have data about patients in our community. So the system we're putting together, we are going to try to enable all of the healthcare organizations to share data through a common format called a CCD. So the CCD has a lot of different data about the patients. You can see here patient demographics, allergies, problems, medication history, data about visits and encounters, data about when they've been admitted or discharged within an organization, labs and imaging. All that data shared on that CCD will be brought into a health information exchange platform. The health information exchange will enable all the different community providers to share data with one another about the patients that they are seeing. So the data will go through the health information exchange, and a master patient index service will be applied. And this is what we spoke about earlier when we talked about the fact that a patient's data is within many different systems, and within those systems their data may not be consistently entered. Key numbers like social security numbers or medical record numbers could be different. The name could be spelled slightly different, which makes matching that data a challenge. But a master patient index service takes all of that data and performs matching algorithms to match patient data and be able to discern when a patient that looks, maybe the data looks slightly different, is really the same patient. And that will really help bring all the data from all those various organizations for a single patient together, so that a physician or a provider can review that data and make decisions about that patient's treatment. So all the data is coming from the organizations through the health information exchange. The master patient index service is being applied, and all that data is being loaded into a clinical data repository. The clinical data repository will support the day-to-day operations of the health information exchange. So when a physician is seeing a patient and they need to uh, review that patient's medical history before they see them or as they make decisions about what the best treatment plan would be, they will bring up the MyHealth portal, and all the data for that patient will be provided to them, and the source database for that portal will be the clinical data repository. But from an analytics perspective, what we'll be doing is taking a feed from that clinical data repository on a nightly basis and loading it into the MyHealth data warehouse. And as we spoke about before, a data warehouse can be used to really prepare the data and restructure it and perform calculations that are needed for reporting. So that way, the database will be prepared to answer the questions that we anticipate our providers will be asking as they seek to leverage that data. Then coming out from the MyHealth data warehouse, we will go into the MyHealth Advanced Analytics platform, and we are using a tool set called Pentaho. It's an open source business intelligence platform, and it will provide, among many other things, dashboards that providers can use to understand how they're doing on their various quality metrics. And another key feature is what we refer to as an organization's analytics sandbox. So the sandbox, as it sounds, is a place where they can go in and play, in a sense. Obviously, it's much more serious than playing, but they can explore the data that is coming through the health information exchange about their patients. And they can seek to answer questions about how their organization is performing against the different quality metrics that will be available. And whenever they see an opportunity for improvement, they can drill down into the data and maybe find where they are most struggling within their organization, and then take that data and use it to draft improvement plans and implement improvement plans within the organization in order to move things forward. And from a organizational oversight standpoint, we have the MyHealth Clinical Quality Committee, which is made up of many of the medical leaders in many of our healthcare organizations. They are going to help us by providing clinical input to the design of our analytics platform, and then they will also be able to take what they know about our analytics platform and go back into their individual organizations and help design interventions and help get the use of the analytics platform really moving within their organization, so that their organization can use the analytics platform to help improve the quality of